Feeling trapped in the cycle of antidepressants, want to quit, but really aren't sure how you can do that? Well, you're not alone. Millions of people struggle with the side effects of these medications. But what if there was a simpler way to taper off these medications without any of the harsh withdrawal effects? Enter microdosing with psilocybin. Welcome to the channel, folks. My name's Fola, and here on Deep Mind Squared, we talk all things magical practices and altered states. And as a psychiatric nurse and psychedelic integration therapist, I've witnessed many people seeking to create lasting change in their mental wellness and overall health. Having had my own personal experience with depression and anxiety, I know it isn't always easy, but it is possible. And psychedelics and plant medicine are a re-emerging science that is helping many people break out of what they thought was impossible. The practice of microdosing is one such tool. The microdosing involves taking a sub-perceptual dose of a psychedelic or plant medicine. And in this video, I'll be referring to microdosing psilocybin specifically, the active ingredient in magic mushrooms, so you can achieve the therapeutic benefits without any of the psychedelic effects. And a quick note here is just to mention that this information is for harm reduction and educational purposes. It's not medical advice, so please consult your healthcare provider before diving into any psychedelic medicine or even changing any of your prescribed medications. Now, why would someone want to discontinue antidepressants, you may be asking? Antidepressants can help elevate a person's mood, and after time, they may feel like they don't really need the medication anymore. So the desire to no longer be reliant on medication can be a big motivator. For others, such effects such as weight gain, sexual dysfunction, and fatigue can make consistency difficult. There's also the possibility that for some, taking medications can be costly, especially if you don't have insurance coverage. Maybe you feel called to stop your antidepressants for some of those listed reasons, or for something completely different. So what do you need to know about tapering off these medications? Discontinuing antidepressants can be quite the journey, and speaking from personal experience, I definitely don't recommend doing it cold turkey. Withdrawal side effects or the symptoms that occur while detoxing the body can take as long as 4 to 6 weeks. And some of these symptoms include dissociation, an increase in anxiety or depression, behavioral changes, difficulty sleeping, body pains, nausea and dizziness, and even sensations of electrical shocks in the brain known as brain zaps. But is microdosing psilocybin really a safe and effective way to taper off antidepressants? Anecdotal evidence suggests microdosing can help alleviate withdrawal symptoms while providing a sense of calm and relaxation during the tapering process. For those who feel stuck on antidepressants, this may come as a relief and an opportunity to begin to return to normal. But what about the risks? Some experts warn that microdosing may have negative side effects, including increasing anxiety, paranoia, and even leading to psychosis for those with a history of psychotic illness. There is also the possibility that microdosing over an extended period of time could impact cardiac health, so your heart health in those predisposed with heart conditions. It's also important to note that psilocybin is still considered an illicit or illegal substance in most countries, so it's not easily accessible, and there's obviously legal implications of having it. Another risk that could be applicable to some people's situations is a severe medical condition called serotonin syndrome, which could be fatal. Yet it seems that the concern of serotonin syndrome being present with psilocybin specifically is reduced when compared to other psychedelics such as MDMA. So how can you go about beginning the tapering process? The recommendation is to start with adding a lower end microdose of psilocybin, up to 25 milligrams, and then increasing it by 25 milligrams every 3 days or so as tolerated, making it up to 100, 150, or even 200 milligram doses. One would also be reducing the antidepressant dosage very slowly over multiple days. One example could be to break up the antidepressant tablet, measuring it using a scale that reads to about 1,000th of a gram, and then reducing the antidepressant by every 2 milligrams every few days until your desired dose is obtained. Of course, there are situations where people may find it's best to only lower the dose and not go off completely. If that's the case, continue to monitor with your treatment provider and consider using microdosing as a regular on-off practice. It's my personal opinion that we only microdose for maybe 6 to 8 weeks and then take a break. You listen to your body. Having witnessed many folks on their microdosing journey and experiencing the benefits of microdosing myself, it's my opinion that the benefits often outweigh the risks. If you're curious about lowering your antidepressant dosage or even completely going off medications, there are other ways to ease the withdrawal effects during the tapering process, whether you're using microdosing or not. Some of these include adding alternative modality treatments such as acupuncture or even Reiki, the universal healing technique, and taking supplements like omega-3s or magnesium, which help calm the nervous system and have an anti-inflammatory effect on the brain. Make sure that you're eating a well-balanced, nutrient-dense diet to add any of those other necessary nutrients that can help support the tapering process and elevate your mood. In terms of using microdosing specifically to taper off antidepressants, I would recommend working with an ethically sound and trained provider if you're considering working with any psychedelics, let alone microdosing. An integration therapist can help you determine if that's the right choice and what you can do to support your own healing journey. In addition to working with a professional, it's important to approach microdosing with conscious intention. And this means setting an intention for your microdosing practice and being aware of any thoughts, any feelings that arise during the experience. Ultimately, microdosing may be a helpful tool for some people who are trying to taper off antidepressants, but it's obviously important to weigh the pros and the cons and approach it mindfully. And remember, there's no one-size-fits-all solution when it comes to mental health, so it's important to work with people you trust and find what works best for you so you can find your own normal. I hope you found this information helpful. You can share your thoughts and your own experiences with microdosing or tapering medications in the comments section below. And if you're curious about learning more about microdosing and how it can support your personal journey, I invite you to check out our website, deepmindsquared.com. You can learn more about microdosing integration and some of the other offerings that we have. That link is in the description box below. If you enjoyed this video, I invite you to hit that like button and the subscribe button so that you're updated on future content related to altered states and magical practices. And until next time, I will see you soon.